And it's time for today's hometown expert. Endometriosis is a scary word, but as Claudia shows us, it's also a very common health problem for women.
Hey ladies, back at the Advanced Fertility Center. Now, we're going to talk today about endometriosis. Now, if you've been trying to get pregnant and you've had no luck, endometriosis could be the problem. Dr. Garza, good to see you again. How are you?
Very good. How are you doing?
I'm doing well. Okay, so endometriosis is something that you see very often. For those at home who don't know what it is, what is it?
Well, endometriosis is when the lining, the endometrium, is out of its correct place, and it should be inside the uterus, but sometimes it spreads out along the fallopian tubes and onto the ovaries and into the pelvis, and it can cause pain in some people, scar tissue, adhesions, and even big cyst on the ovaries, and keep that person from getting pregnant. And
I think that's the biggest problem, because us women, we want to have babies. When we have no luck, obviously we're going to come see you. So what is the next step when you see endometriosis affecting a patient?
Well, you know, the first symptoms are pain with your period and even pain with your partner, and then infertility, not being able to get pregnant in 9 to 12 months. And it can even happen in adolescence, so some young ladies that have severe pelvic pain may have endometriosis. Obviously, hopefully they don't want to get pregnant at that point, but you might want to protect their oviries so they have that option later on.
Sure. So what causes it?
Well, we really don't know. It may be genetic, and there's some studies that suggest that. We think that with every period, ladies have a little blood flow back up through the tubes, and only in 5 to 7% does the endometriosis attach to the ovaries or to the pelvis and cause the scar tissue.
Right. Now, ladies, it sounds devastating, but believe it or not, I had a friend who went through a very similar situation. She got treated, and they now have a very healthy baby. So for patients who are facing it or patients who think they might have it, what are the treatments?
Right. First, you probably want to try some medical treatments like birth control pills, medicine for the pain. If that doesn't work, even consider laparoscopy, which is outpatient surgery to look inside and try to laser it. And now there's a new laser with the robotic device that you can pass the dye into the vein of the patient that's in surgery, and with the laser it lights up and you can see the spots of endometriosis and correctly get rid of them and not miss any, and hopefully improve their chances for a pregnancy.
Wonderful. Thank you so much, Dr. Garza. Okay, ladies, pelvic pain, trouble getting pregnant, they could be warning signs of endometriosis, but it doesn't hurt to come ask Dr. Garza at Advanced Fertility Center.
And thank you, Claudia and Dr. Garza. And if you would like more information on Advanced Fertility Center, they are located on Hardy Oak Boulevard, Suite 500. The phone number is 616-0680 and the website advancedfertilitycenter.org. And coming up,